It is National Nurses Week, and you know what? They do such good work, they deserve to be honored.
Yeah, so with us right now, we have Deborah Stamps, Chief Nursing Officer at Newark-Wayne Community Hospital, and Jane McCormack, Chief Nursing Officer at Unity Hospital. Thank you both so much for joining us.
Thanks for having us.
I'm so glad we have a week to honor you guys, but also to look into your profession, because I think a lot of people don't understand the challenges that you face on a day-to-day basis.
We do. Nursing is exceptionally challenging, but exceptionally rewarding. And I think as chief nursing officers, we're very proud, first and foremost, of our team.
Sure.
Because of what they're doing every day.
And you are chief nursing, so you oversee a staff.
Correct.
Okay.
Correct.
And so what do you see then is the biggest challenge for nursing today?
The biggest challenge for nursing today is we're facing a shortage. And a challenge of recruitment of experienced nurses. You know, we're very fortunate to be in the Finger Lakes, where we have a number of wonderful colleges and universities and schools of nursing. But the challenge comes with the aging of the population of the nurse. Our average age of nurse now is just over 55.
Really?
And our faculty are also aging. And in a study that was done probably back in about 2008 or 9, the average age of faculty is upper 60s, mid-60s. So the challenge is to recruit new faculty and to recruit, or keep experienced nurses at the bedside. You know, with healthcare changing, in our system, the Rochester Regional Health System, we care for patients from Batavia all the way to Wayne County. And the challenge is that patients are not going to continue to be cared for in hospitals. We're going to see more care provided in the community.
Yeah, across the continuum.
Yes, and so where there's challenges, there's also great opportunities in nursing. So you're going to see more nurses out in the field versus at the bedside.
It's interesting.
So Jane, speaking of that, going along with this, what advice would you offer a senior in high school right now graduating and they're interested in the nursing field? Where should they go? What should they look at?
Yeah, we absolutely, now is our time to look at our youth and explain what opportunities. Frankly, I think the best way to say it would be nursing offers the most diversity that we ever have in whatever you want to choose to do. We historically think about a nurse at the bedside in a hospital, but there are so many different roles for a nurse to pursue. New and upcoming is clinical informatics, nurses that go into education, so we're reaching out to our young that want to take a career that can pretty much guarantee you a job for life.
There's great volunteer opportunities for high school students in hospitals that could expose them to not only the profession of nursing, but other healthcare professions as well, because there is a great variety. And we have nurses, like Jane was saying, that are infection preventionists, researchers. So there's the variety is endless to what you can do and impact the health of our communities.
That's amazing. I mean, but when you think about what a nurse does, nurses are they can be very specialized, can't they?
Yes.
Yes.
And, you know, almost do what a doctor can do, right?
Well, we think about nurses that advance to a nurse practitioner degree, for example, which is a graduate degree. And they really do practice at top of license. They're recognized as independent practitioners, and it's a way we're looking at in healthcare, because one of our biggest goals, particularly as chief nursing officers, and serving in an administrative capacity as well as looking out after our staff, we serve in that linchpin position, is looking at cost of healthcare. We have a triple aim. It's controlling cost, it's providing the best experience, and it's giving care across the continuum. But you look at roles like nurse practitioner, and what could we do differently that would offer our community a good health service?
It's amazing.
Yeah, real quick, Deb, we have about 30 seconds left. You guys are on the front line. How do you care for yourselves? Because you're so busy caring for others.
You know, that is really tough.
That's a great question.
Well, unfortunately, we have like 10 seconds left,
That's
so
a
I
whole other
apologize. I
segment.
kind of threw it out there.
That's a whole other segment.
You'll have to have us come back.
Yes, we'll have you come back and answer that.
That's a deal.
Thank you so much.